Is it possible to check for HPV without going to the hospital? Let's look at these female self-examination products. As more and more women begin to focus on gynecological health, many businesses have introduced various female self-examination products. There are indeed a group of girls who are too busy to go to the hospital, or have a fear or shame of gynecological diseases, making self-examination products a natural choice. So, can we rely on self-examination products that can be easily purchased for health testing? We have selected a few commonly asked and commonly found female self-examination products on the market, and today we will take a look at them. Vaginal pH test strips. We have talked a lot about the pH value of the vagina. Lactic acid bacteria can maintain the pH value of the vagina at around 4.5. Within this range, the vaginal microenvironment can be kept in balance and control some bacterial population's growth. For example, for the white-curdled bacteria that cause candidal vaginitis, the suitable growth environment is pH around 5.5. If the pH value of the vagina changes significantly, it may cause a bacterial imbalance, leading to gynecological inflammation. This makes many girls start to wonder if their pH value is within the healthy range, and some discomfort in the private area also begins to suspect that the pH value has changed. In such worries and twists and turns, the final choice is to buy a pH value self-examination strip test. The method of use is straightforward. Use the swab provided to collect a sample from the vaginal wall, put the swab on the test strip, and match the test strip to the pH level chart. Accurate and easy-to-read results will display in a few seconds. This test is made with the same high-quality litmus paper used by physicians to monitor pH balance. Actually, it is unscientific to determine the health of the vagina by testing pH values. It is only a reference for inflammation. Furthermore, the material applied to the strips and vaginal secretions will also contain urine, sweat, and other components. Moreover, it will be affected by factors such as cohabitation, cleaning agents, etc. However, when looking at product reviews, many ladies say it is good. So how is it good? One girl said, "I feel that the test is very accurate and similar to my guess." Girls, whether or not we are sick, we can't diagnose it by guessing, we still have to be responsible for ourselves. In the product reviews, many girls say that they are embarrassed to go to the hospital. Every time we see such comments, we find that the road to equipping the population with common scientific sense is still very long, and everyone's understanding of gynecological knowledge is not enough. There are too many misconceptions about these diseases. This also makes us understand why a product with so many uncertainties can have such high sales. However, I still want to remind girls that getting a gynecological disease is not something to be ashamed of. Even if you don't have sexual activity, you can still get vagina inflammation. This doesn't mean anything, and it's normal to go to the hospital when you're sick. You can't put a shameful hat on it just because it's a disease of a private part. Health should still be the first priority. Syphilis, AIDS, hepatitis B, and hepatitis C testing. When it comes to infectious diseases, everyone can't avoid them, but viruses always hide in places we can't find. They can invade our bodies at any time. But in fact, the high-risk routes of infectious diseases are only sexual transmission, blood transmission, mother-to-child transmission, kissing/close/towels, and AIDS. Hepatitis B and hepatitis C will not be transmitted through kissing/close/towels, so there is no need to panic too much. If there is a simple and convenient way to detect them in time and treat them early, it can also help many patients. Due to the latent nature of these infectious diseases, such tests usually require multiple uses. As for the method of use, it still depends on being harsh to oneself. You need to use the product's own blood collection needle to puncture your finger and squeeze out blood, then use a straw to suck it, and then drop it in the sample hole, and wait for the observation result. The core principle is antibody and antigen specificity binding. If there are disease antibodies in the blood, it will bind with the antigen on the test kit, thereby indicating a positive result. If not, it will be negative. In-home HIV test. We found this in-home HIV test that is an FDA-approved test for HIV-1 and HIV-2. It's an oral swab test that doesn't require blood. It's completely private. A positive result with this test does not mean that you are definitely infected with HIV, but rather that additional testing should be done in a medical setting. A negative result with this test does not mean that you are definitely not infected with HIV, particularly when exposure may have been within the previous 3 months. If your test is negative and you engage in activities that put you at risk for HIV on a regular basis, you should test regularly. This product should not be used to make decisions on behavior that may put you at increased risk for HIV. Hepatitis C test, at home. This test lets you discreetly check for exposure to the hepatitis C virus, HCV, all from the convenience of your home. The test arrives in discreet packaging and includes everything you need for sample collection. Only a tiny amount of blood is required as a sample. Gain meaningful insights about your health with easy-to-understand test results. Such products are simple and convenient to operate, which is an advantage, but they can only be used as a preliminary screening reference. After all, many factors can cause false positive or inaccurate results in self-examination. For example, when diagnosing syphilis in clinical practice, serological test results must be combined with the patient's epidemiological history and clinical presentation to make a comprehensive judgment. When necessary, further confirmation or exclusion of infection can be made through follow-up. After looking at product evaluations, a friend said, "I had a pimple on my neck, so I searched online and it said I might have an STD, so I bought a test." It's 2023 now, it's no longer good to diagnose yourself by searching the internet. If you are really worried or suspicious, you should go to the hospital for a regular examination to eliminate concerns. If there is really something wrong, you can also avoid delaying the disease. HPV self-examination kit. HPV virus is the main culprit of cervical cancer, which is spread through sexual activity. Currently, there is no specific medicine for it. It can only be monitored and prevented through regular screening. However, we all know that HPV is divided into many subtypes and usually, in clinical practice, after taking a sample, it will be sent to pathology for subtyping and also about the TCT results, it will be determined whether a colposcopy is needed to evaluate whether there are suspicious lesions on the cervix. Many types of self-examination products on the market are not sensitive to subtyping without lesions, which means that if you are infected with HPV, you will not know which subtype you are infected with, whether it is low risk or high risk, and may also give false positive results due to chronic inflammation. In addition, it is essential to note that in general, during clinical testing, doctors will use a colposcope to spread the cervix and take a sample. At the same time, self-examination products are difficult to collect samples from the cervical area. Therefore, the results obtained from the HPV self-examination kit are not accurate. Cervical lesions should be considered, so it is better to rely on something other than self-examination products. Helicobacter pylori, H. pylori, test paper. As we've mentioned many times before, Helicobacter pylori is a common chronic infectious bacteria that the World Health Organization lists as a first-class carcinogenic factor for stomach cancer. When infected, it can easily lead to gastritis and stomach ulcers, with symptoms such as upper abdominal pain, fullness, nausea, and bad breath. That's why people often avoid mentioning it. However, the cunning Helicobacter pylori can spread through oral-oral and fecal-oral routes, with oral-oral referring to a person eating infected saliva directly or indirectly, and fecal-oral referring to touching contaminated items with feces and not washing hands before eating. Helicobacter pylori detection at home detection kit. So, many friends suspect they have been infected with Helicobacter pylori as soon as they have stomach discomfort, but in fact, the probability of adult infection is far lower than that of children. Coming back to the Helicobacter pylori test paper, it is used by collecting fresh morning plaque before brushing teeth and applying it to the test paper. The test paper has red and yellow colors, with red indicating positive and yellow indicating negative. However, the number of Helicobacter pylori in the oral cavity of adults is limited, and even if it is detected positive in the oral cavity, it does not mean that the bacteria in the stomach is still active, so it is not a reliable reference for detection, with both false positives and false negatives being very high.